All right, so we all have to face it, talking about aging, of course, and over time, our age starts to show up on our faces. So now there's a so-called natural way to restore your youthful appearance. Joining us this morning to tell us a whole lot more about it is Orlando cosmetic surgeon Dr. Roger Basson and two of his customers, Mary Beth Lavin and Roxanne Risley. Thank you all for joining us today. All right, Dr. Basson, we are talking about the NaturalFill face filler. Explain how it works.
Okay, so what we're using is we're using our patient's own fat to remove it from one portion of their body to put it in another area of their body where they're deficient. And for this particular purposes, we used it in our patients' faces where they were deficient of some fat. Now, the main benefit for this type of procedure is that the way we're pulling the fat out now, using the aqua lipo procedure, does not damage the fat cells. So now the fat cells are alive or viable, so you can get a permanent result from it, versus the old style fat transfer procedures where the fat was really beaten up from the old style liposuction procedures, so that's why it was really a poor procedure. Now we're able to use it to fill in all areas of the body that are deficient in volume. For our patients over here, their faces, we use it for breasts, we use it for buttocks, we use it for anything, and it gives you a permanent result.
So where do you get the fat from, like saddlebags, muffin top, butt? I mean, where do you get it from?
Yes. Okay. Anywhere. But the places that I like to get the fat out the most to use the NaturalFill for is actually the outer thigh area, because that seems to be an area that is very diet and exercise resistant. So this fat that's diet and exercise resistant, we want to put it in an area where we want it to maintain being diet and exercise resistant, so we can put it back in the areas where it's deficient.
Okay, Mary Beth, you are one of his customers and you've had it done to your face. We do have the before and after pictures of you, Mary Beth. And I have to be honest with you, Dr. Basson, I didn't see much of a difference in her face.
Well, what you're looking for is you're looking at her mainly nasolabial folds, okay? But where Mary Beth was deficient was actually in her cheeks.
Oh.
So what we did was we gave her the volume back in her cheeks to give her back the natural look to the more youthful volume that we have in our cheeks, and that's really where she was deficient.
Mary Beth, did it hurt?
Not much.
I mean, tell us the truth. Be honest with us.
No, it really did not hurt very much at all.
So do people notice a difference in you, or do you notice a difference when you look at yourself in the mirror?
I absolutely notice a difference, and other people do as well. They're just not quite sure what. They know that I look better. I had my sister say, "Your hair looks nice," and I know that it was actually my face. But it's very subtle, and I like subtle.
All right, you're gorgeous either way you come. All right, Roxanne, we also have your before and after pictures as well. Now, where did Roxanne have the fillers placed?
Well, Roxanne had the fillers placed in pretty much the very typical area, what we call the nasolabial folds. That's the lines between the nose and the mouth, and the marionette lines, which are kind of the lines that drop down from the mouth. So that's a very typical area to have these fillers put in, and this is where we put the NaturalFill for her.
Roxanne, why was it important to you, though, to have that done? I mean, because you're a stunning woman.
Oh, well, thank you. Well, my smile is probably the best part of my features, and I've always had a great smile, and I wanted to keep it. And I noticed that it was getting deeper and deeper, and then the jowl lines, and I'm at the age where it starts to show, and I want to continue to be the new 40.
All right, so you work it like that. Dr. Basson, how much does it cost?
Okay, for this procedure, you're looking at a ballpark around $2,000, depending on how many areas you get filled.
Okay.
But taking a look at that cost, if let's say Roxanne were to go get Restylane and Juvederm, she would have probably had to spend about $1,500 for that, which would only last her about 6 months. And then she'd have to come back again, and then come back again. Whereas this is a one-time outlay, and it's a permanent result.
Permanent result, $2,000, and you can put your best face forward. So cliche, but I had to end the interview that way. Thank you all so much for joining us today. Heidi and Talitha, over to you.
Have all kinds of good ideas where to rearrange things. All right, Jackie, thank you.